Welcome to another episode from the Veterinary Research Channel. Today, we delve into a retrospective study that explores the use of octreotide in treating protein-losing enteropathy, or PLE, in dogs, offering a beacon of hope for those cases that don't respond to standard therapies. Our story begins with the understanding of PLE, a syndrome marked by excessive protein loss across the intestinal lining, often complicated by chronic inflammatory enteropathy, known as CAE, and intestinal lymphangiectasia, or IL. Intestinal lymphangiectasia involves the widening of lacteals, lymphatic obstruction, and lymphangitis, varying in severity throughout the small intestine. Certain dog breeds show a genetic predisposition to intestinal lymphangiectasia, although it can also arise secondarily from conditions disrupting lymph flow, like chronic inflammatory enteropathy or neoplasia. Intestinal lymphangiectasia is a common finding in dogs with protein-losing enteropathy. The presence of intestinal lymphangiectasia alongside decreased levels of serum albumin, cholesterol, and 25-hydroxyvitamin D may indicate a worsened prognosis. Despite its identification as a cause of protein-losing enteropathy over half a century ago, intestinal lymphangiectasia remains somewhat of a mystery, lacking a definitive consensus on optimal treatment. Sadly, nearly half of dogs with protein-losing enteropathy succumb to the disease. Traditional treatments include diet adjustments, glucocorticoids at varying doses, immunosuppressants, and supportive therapies, regardless of the precise cause. Octreotide, a long-acting somatostatin analog, has shown promise by decreasing intestinal fat absorption, inhibiting gastrointestinal vasoactive peptides, and stimulating the autonomic nervous system, proving beneficial in some instances of primary intestinal lymphangiectasia in humans. Though octreotide's use has been documented in treating chylothorax, insulinoma, and gastrinoma in animals, its application for intestinal lymphangiectasia or protein-losing enteropathy in dogs remains largely unexplored. This leads us to the study's objective, to illuminate the use of octreotide in dogs with protein-losing enteropathy, documenting the reasons for its prescription, the specifics of its administration, any adverse effects, and the observed responses. The study is a multi-center, retrospective analysis, compiling cases from various veterinary practices where octreotide was used for protein-losing enteropathy. The cases included dogs diagnosed with protein-losing enteropathy based on clinical signs or histological confirmation of chronic inflammatory enteropathy, intestinal lymphangiectasia, or both, and were treated with octreotide. To be included, cases needed at least 1 month of follow-up data after starting octreotide. Lipogranulomatous lymphangitis cases confirmed histologically were also considered. The criteria for diagnosing protein-losing enteropathy included a history of gastrointestinal issues lasting at least 3 weeks, low serum albumin levels, and the exclusion of other causes of hypoalbuminemia, such as liver or kidney dysfunction. Exclusion protocols involved urinalysis, serum bile acid tests, fecal screenings, and trypsin-like immunoreactivity tests to rule out other conditions. Abdominal ultrasounds were also performed to exclude extraintestinal diseases. The study gathered a wide array of data, including the dog's demographics, clinical signs, duration of symptoms, weight, body condition, and muscle condition scores. Serum albumin, globulin, and cholesterol levels were tracked, along with any additional relevant biochemical data. Information on intestinal inflammation, the presence and degree of lacteal dilatation, octreotide usage details, concurrent therapies, and follow-up clinical signs were carefully recorded. The long-term outcomes, such as whether the dogs were alive or had died due to protein-losing enteropathy or other causes, were also noted. Out of 24 candidates, the study included 18 dogs. These dogs represented various breeds and presented with common clinical signs such as diarrhea, reduced appetite, weight loss, and vomiting. Before diagnosis, the clinical signs had been present for a median of 12 weeks. Diagnostic tests confirmed that all dogs had low serum albumin, and other conditions were ruled out. Abdominal ultrasounds revealed common abnormalities, such as peritoneal effusion and small intestinal changes. Endoscopies and laparotomies confirmed lacteal dilatation in several cases. Histopathology reports from intestinal biopsies confirmed lymphangiectasia in the majority of cases, accompanied by inflammatory infiltrates. Following the initial evaluations, most dogs were prescribed a therapeutic diet and maintained or started on prednisone or prednisolone. Additional medications were also administered. Octreotide was initiated after a median of 5 months from the protein-losing enteropathy diagnosis. At the start of octreotide treatment, all dogs still showed clinical signs and were on steroid therapy and special diets. The octreotide was prescribed as generic octreotide acetate. The adverse effects were reported in a few cases, including pain at the injection site and urgent diarrhea. Interestingly, in 12 dogs where octreotide was the only change in their treatment, half showed clinical improvement, including better stool consistency, reduced diffusion, improved appetite, and increased energy. In these dogs, serum albumin levels also improved. Cholesterol concentrations also increased in dogs, showing a clinical response. The dogs that showed clinical improvement received octreotide doses of 30 to 60 micrograms per kilogram daily and were mostly on low-fat diets. By the second evaluation after octreotide initiation, the medication was adjusted or discontinued in some dogs based on their response. Long-term data showed that many dogs were still alive, with some continuing to receive octreotide. The study indicates that octreotide is often considered for dogs with protein-losing enteropathy and suspected or confirmed intestinal lymphangiectasia that haven't responded to traditional treatments. In a subset of dogs where octreotide was the only therapeutic change, half showed clinical improvements. The drug was generally well tolerated. Given that roughly half the dogs with protein-losing enteropathy don't survive despite standard treatments, there's a pressing need for new therapeutic strategies. Octreotide's potential lies in its ability to reduce intestinal fat absorption and modulate the lymphatic system. Drawing from human studies, octreotide has demonstrated promise in treating primary intestinal lymphangiectasia, where it is believed to act by inhibiting gastrointestinal vasoactive peptides and stimulating the autonomic nervous system. It has been observed to reduce intestinal fat absorption and lymphatic fluid outflow. However, its application is primarily supported by case reports and series, which makes standardized dosing a challenge. The study highlighted that the median dose of octreotide in dogs that appeared to benefit was 30 micrograms per kilogram, administered subcutaneously daily, with the majority of these dogs on low-fat diets. The study noted adverse effects in a minority of dogs, aligning with those reported in humans, such as nausea, diarrhea, and abdominal discomfort. However, it's important to acknowledge the study's limitations, including its retrospective design and the absence of control group, which makes it difficult to definitively conclude octreotide's effectiveness. Variations in diagnostic data and biopsy locations further complicate the analysis. To determine octreotide's true potential in treating intestinal lymphangiectasia and protein-losing enteropathy, a prospective, controlled clinical study is essential. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.